Hello, I'm Frankie from Nottingham City Targeted CAMHs, and I'm here today with the How You Doing podcast, focusing on trauma-informed practice and specifically working with children and young people for trauma-informed practice. So, what is trauma? And what does this mean? Bessel van der Kolk states that trauma is specifically an event that overwhelms the central nervous system, altering the way that we process and recall memories. Trauma is not the story of something that happened back then, he adds. It is the current imprint of that pain, horror, and fear living inside of people. So by the end of this podcast, we would hope that you're able to understand what trauma is and to be able to support children and young people better by applying a trauma-informed practice approach. So this section is called Trauma is in the Eye of the Beholder. So trauma is actually something that is re-experienced in the body in the present moment. And it can be seen in the inability to cope in the moment, having the perception of having no control or not being safe, not expecting the traumatic event to happen. So is this true or is this false? A traumatic event is the same as an everyday frightening event. That is false. So a traumatic event does differ from everyday frightening events. So some examples of this is the threat of life, survival, the threat of that of a loved one, sudden threat of death, serious injury to yourself or to a loved one, unusual, sudden, out of the ordinary events, so not everyday events, something that overwhelms our capacity to cope in the moment, and we experience an overwhelming sense of helplessness, terror, horror, and fear. So currently in the world, we're going through a global pandemic. So this is something that is a threat of life, that there is a threat of death to self and loved ones. It overwhelms our ability to cope. It's unusual, it's out of the ordinary. And we can experience an overwhelming sense of helplessness and terror, especially if we're watching the news and we're seeing the death toll increase. So if children and young people are being exposed to this and they're witnessing these things, then that can cause a traumatic response in children and young people. So I guess I'm doing this today so that we're mindful about the effects of the global pandemic and of children going back into school, and ways that we can support children and young people in a trauma-informed practice approach. So there are different types of trauma. One type of trauma is acute trauma, which is a one-off event, such as the sudden death of a loved one, a traumatic death, a car accident, and this can happen to anybody at any time. Chronic trauma is when something keeps happening, such as domestic abuse, and there's a pattern over time. Complex trauma are multiple events, such as domestic abuse and a car accident happening, and bereavement. System-induced trauma is things like racism, children that are living in the care system, placement breakdowns, restraining a sexual abuse victim, for example, and re-triggering and re-traumatizing. And then vicarious trauma is professionals that are traumatized by working these cases. So how do we know that a young person is having a trauma response to a particular event? What might they say? What might they do? So they might have intrusive symptoms such as having bad thoughts and flashes back to the event itself. They might not be able to shut their brain off, so they might be overthinking a lot. They might go the other way and go really withdrawn and avoidant. They might suffer with night terrors and really bad sleep problems because they're thinking about the event. Certain senses can trigger that trauma, so a certain smell can take you right back to that moment. They'll be reliving the event through other things. So for example, if a car backfires, it may take them back to the moment where they heard a gunshot. They might have a negative mood and negative connotations as well, such as, oh, if only I did something instead, if only I could have said this, if only I could have done that, if only I had a superpower to stop it. There's often a lot of misplaced guilt and shame with trauma. Additionally, you can have a child and young person that takes a lot of risks, or that they can't concentrate when in school. They maybe can't sit still and they're fidgeting quite a lot, can be quite aggressive and very hypervigilant. So they might say things like, "What are you looking at?" And that's a trauma response from what might have happened. It's really important to know that it's a normal reaction to a traumatic event to be in shock, anger, anxiety, and withdrawal. We are just human beings. So children that have been through adverse childhood experiences, such as abuse, neglect, parental mental health, childhood abandonment through separation or divorce, household family members in prison, domestic violence, and so forth, are likely to suffer a trauma response. So I invite you now to pause this video and click on the YouTube link to watch a clip on adverse childhood experiences. The reason that this video is so powerful is that the research has shown that if you've had 4 adverse childhood experiences or more, you are 2 times more likely to binge drink or have a poor diet when you're older, 3 times more likely to be a smoker, 4 times more likely to have low-level mental health and life satisfaction, 5 times more likely to have underage sex, 6 times more likely to have unplanned teenage pregnancy, 7 times more likely to be involved in violence, 11 times more likely to use illicit drugs, 11 times more likely to be in prison, and you're more likely to suffer heart disease and develop type 2 diabetes. So there are things that we can do to help this so it doesn't go that way. So what can we do to support a child or young person with ACEs? We can help to build their resilience and their protective factors. So Young Minds in 2018 published some research to show that if you develop self-regulation skills, motivating their achievements, building faith, hope and spirituality, having the belief that life has meaning, and really it's all about relationships, so building that relationships with caring adults, and building positive relationships with friends as well. I think showing empathy and curiosity is really important for trauma-informed practice. So asking, how are you now? How did this experience shape you? What type of work do you want to do together? How are the parents coping? And does the family need any support? And how are the family coping as a whole? How did you stay alive? What did you do to survive? So these are really important things to be asking children and young people, but also having compassionate workers, showing empathy with parents is one of the key things to make change. Addressing any bullying or harassment or victimization straight away as soon as it's presented. And helping children and young people find practical solutions to problem solve and really managing that emotional distress. So there are 7 trauma-informed practice principles. Number 1 is recognising what trauma is and what adverse childhood experiences are. Number 2 is addressing the safety. So if they are still experiencing the trauma, no amount of therapeutic intervention is going to work at this moment. They need to be safe. Number 3, resist re-traumatizing. For example, having to restrain an abuse victim. Trustworthiness and transparency is very important, and collaboration of the care plan. So you can't do things for the child, it's got to be in a collaborative way for it to be effective. Giving empowerment and choice and control to the child and young person, because that gives them a sense of power back, and also peer support and mutual self-help. One strategy that we could use for children and young people is the window of tolerance. Now what I usually do is I print out red cards, green cards and blue cards so that the children can identify when they're in each stage and each zone. So when a child's in the red zone, they're really hyper alert. They might be shouting or swearing or running around or aggressive, really hyper alert and like looking around their surroundings for what's happening. When they're in the blue zone, they're really hypo aroused, so they might be withdrawing, they might go really quiet, their body might not move, so they've gone into the freeze mode. So what we try to do is move children from the blue zone and the red zone into the green zone. And by doing that, you can help children recognise which zone they're in by using the cards. So when they're in the blue zone, they really need to activate their senses to come back into the present moment. So kind of getting up and running around, mobilising, getting your body moving, stamping your feet with shoes on. Those are the sensory sort of relief that you need to kind of get yourself into the green zone. And when they're in the red zone, it's the de-escalation strategies. So that's really important for children to recognise when they're feeling that in themselves, in order to recognise that and come out of that zone. So at the end of this podcast, I'm going to signpost you to resources from Young Minds publishing their research on trauma-informed practice, self-help guide on trauma-informed practice, but also for schools, really important strategies to implement in the classroom that understand that behaviour is a communication of distress, or can be a communication of distress. So that'll be really helpful for you to read through and apply in the school setting. I hope this podcast has been helpful and you understand a bit more about trauma-informed practice and things that you're able to do to support children and young people. So thank you for listening.